From the research design perspective, what are, steps that you guys are taking to try to involve patients and families more in that process and reduce some of those barriers to access to participating?
From the statistical side, we don't have a lot of direct involvement with the recruiting, with the patient interactions. But I think the thing that we're working on that really is very patient centric is this idea of saving people time and disease. Whenever people do surveys of patients, surveys of families, and they ask them what's important to them, there's always words in there like prolong or delay or maintain. And all of those words really mean saving people time in their mildest stages so that they can stay in those mildest stages longer, move to the worst stages as long as possible from now, really prolonging the healthier stages of disease and keeping them where they are as long as possible. And I think it's interesting because sometimes when people do surveys of patients and ask them what's important to them, they focus on symptoms and they say which symptoms are important to you. And in reality, this is a whole disease and the whole thing is progressive. And the symptoms kind of move together and they start happening, together. And when you do these surveys and these questions and you see all of those words like maintain and delay and continue to be able to do this or that, those kinds of wording really say the whole disease is important to me. And there might be specific symptoms that are important one day and different symptoms another day, but more critical is sort of that underlying disease progress and being able to slow it down. And that comes back to Jeff's earlier comment about how meaningful the breakthrough of being able to have disease modifying therapies approved really is to the field, because that disease modification is very different than symptomatic benefit. And we need to think about it differently and realize that that is a much more inherent benefit to patients and their families than specific symptom targeting.